Hello, assalamu alaikum, good morning, khushamdi, ji ayanu, goeiemorgen.
Pakhair agale, ni hao, jude shumme, washmale, ohaya gazaimes, guten morgen, hola, bonjour, privyet, kaifa hal, hala shabachatore, ahlan wasalan, marhaba, buna, mucho, gracias, swavi up, and a very amazing good morning to everybody who's tuned into PTV World and are watching World this morning, finally, alongside Shiza Hashmi and Shahzad Khan. Hello Shiza, how are you doing today?
I am absolutely great. Thank you so much for asking. And I'm happy that we're doing the show together finally after more than a month, I feel like.
Exactly.
Before earlier you were gone and then I was gone and well, we're here together again.
Exactly, ladies and gentlemen, and for everybody who's out there, ladies and gentlemen, we definitely hope and pray that everybody is looking after themselves. You know, these times are very full of stress or probably distress as well. And I think what we really need to do is just take all the precautions which are necessary. But other than that,
Hold on though, because I want to take this minute to appreciate all the efforts that you, including every single member of my team, have been doing, because I was, of course, you know, sort of keeping a check on the show as well. So when you returned, you were maintaining social distance even at home. I follow him on a Snapchat and everything, and I'm telling you, this is first-hand information, ladies and gentlemen. And then on the show as well, there was proper, you know, distance between you and the guest with all the masks and gloves. Kudos to you guys for, first of all, you know, having the courage to come up every other morning and share your mornings with the entire, well, Pakistan and more than 40 countries in the world as well. And I really hope all of you are safe out there as well.
Well, thank you very much for saying that. And ladies and gentlemen, I think that there's only one thing, and that's something which I was even discussing with Shiza as well yesterday while we were preparing for the show, and that was that, Shiza, you know, the only thing we need to do is not to touch our face while we are at work. And, that's what we're looking forward to as well. But other than that, ladies and gentlemen, since Shiza said that finally we are doing the show together, there's a reason. So I was traveling, I didn't know that, you know, that this pandemic is going to...
It's going to be a pandemic.
That it's going to be a pandemic from an, you know, so in other sense, I think that what I really need to ask Shiza is, where was she? So, okay, so for all of those people thinking where she was, ladies and gentlemen, congratulations to my colleague, because she made sure to get married within these times as well, and made sure that the marriage is going to take place just like we're keeping social distances from each other as well. So I think that this is something which I need to ask Shiza, because a lot of people have postponed their weddings, or somebody got their nikah done but couldn't go for walima, or somebody got done with their mehendi and then couldn't do the nikah or the walima as well. So she was the lucky one. So how did you manage to do all of this?
First of all, thank you for the wishes. Second of all, my walima is still due. Third of all, I'll tell you. So personally, if you know me, I'm not a social person. I'm not an extrovert. So we always wanted, you know, so to have a small wedding, and it was really hard for the guy and me to convince our families, you know, Pakistani families, to actually have a small wedding, because my sisters, my parents, they were like, oh, ek mehndi, ek dhol, you know, and the things keep increasing, almost 7 to 9 events, and I was like, I have no idea how I'm going to do this.
Exactly.
But I want to say this, I want to say luckily, although I'm really sorry about the pandemic, but luckily we got a chance, sort of, you know, to either postpone the wedding or just carry it out on the same date on a, well, smaller scale. And then we were like, why not? Let's just do it. And our parents were really complying to our sort of request as well. So we did it at home with hardly, and I'm not lying, 12-ish people.
That's it.
It was just immediate family, like my siblings, my parents.
And was like everybody sitting like at a distance?
Well, sort of course. Because you know what, my entire house was sort of decorated. And there was a huge space with only, well, 12-ish people. So we were having a good time. We were sort of interacting as well. And to be honest, in the beginning, you know, everyone was on to hand sanitizers and everything and, you know, keeping the distance. But then they were like, it's a wedding, let's just, you know, get together and enjoy. So that's what we did. It was a one-day event or affair. And well, it happened, and I need your prayers, everyone.
And congratulations, and you know, congratulations not just from myself, but from on behalf of our entire team as well. You know, my producer, you know, our cameraman, everybody who works over here, and people, you know, who just watch us every single day. They've been asking about you too as well. So, ladies and gentlemen, yes, bon voyage. I think that's what I'm going to say, because it's a newer journey, and we want this journey to be very fruitful for you and peaceful as well. But then at the same time, ladies and gentlemen, this is how life is. You know.
The show must go on.
Yeah, the show must go on, and it's not that we really need to sit down and just don't do anything. There are a lot of people who are doing a lot of things for other people as well, and I think everybody needs to indulge in an activity of such sort. Because I'm going to give you an example. Imagine that for all of those people who used to beg on the street lights, now coming to your doors and doorsteps as well. Every now and then when I'm at home, I'm on my terrace, I could see that there are people, you know, who are really in need of food, who are really in need of, you know, all of these sanitary items as well, and they're not available. Not just that, they do not have that power to purchase that as well. So a lot of people have jumped in and they are making sure that they're going to help other people as well. I have a lot of friends, and you know, even today, ladies and gentlemen, the show is about that. So today what we've done is, ladies and gentlemen, that we've actually been invited by we have invited some people who are going to let us know how they're actually trying to help the masses over here in Pakistan as well. Shizad, what do you
Well,
want
the brilliant thing about this, Shazad, is that these people were not posting anything on the social media, because that is what we see as well, right? People doing something good and then sharing it with the entire world as well, which is, I mean, okay, it's great that you're doing a good gesture for the people in need. But, well, this is my perspective, Shazad. While, yes, you may sort of set an inspiration for a lot of people by sharing your picture, I feel like there's sort of a hidden motive as well when you share, right? You want to feel good about it. It's okay if you feel that way, as long as you're doing good to others as well. But these people specifically did not do that. That is why I felt like mentioning it.
Exactly.
Before we introduce them, we do have a video from their work. And before they shared it, I don't think they're ever gonna. That's why we are going to.
But before we do that, you know, I've got a difference of opinion over here. So, you know, it's great, Shiza,
and it's okay as well.
And you made a point, that's fine. But as far as the kind of education I've got, the kind of religious education I've got, you know, what I know for sure is that it totally depends on you. Whether you want to do a neki and then share it with other people, it totally depends on you. And if you do a neki and you do not want anybody to know, that's totally dependent on you as well. But the motive of sharing is so that more and more people can actually take inspiration from it and then do the same for other people. But for people who are actually just trying to get in the likes, I don't think that that was a good idea. But right now, ladies and gentlemen, we've got a small video. You need to look at this, because these people are really making sure that they're looking after all the people, irrespective of gender, race, or wherever they belong from. Let's take a look.
Let's take a look.
That we are lucky.
All right, ladies and gentlemen, so that was a small video, and you know, there's only one thing which I need to say, and that is faith restored, ladies and gentlemen. There are still people who are working for the betterment, and they're working for the betterment of the country as well, and they're making sure that everybody is healthy, they have ample food to eat at their homes as well. And the best part about all of this, ladies and gentlemen, that we're particularly doing a show is that they're not going out on streets, they're going door to door, they have that data to themselves as well, they're volunteers, and they're making sure that their volunteers are safe while they're on their volunteering job as well.
Right, and Shazad, you know, there were two types of people when this pandemic started as well. Ones, the ones who were actually shopping everything off the racks in supermarkets and, you know, stores and everything. And then there were the other people who were shopping everything off the racks, but not for themselves.
Exactly.
For the people in need. And these are those people, ladies and gentlemen, that we're talking about, the second type, who are actually helping the people in need, who are actually helping the people who won't probably have, let's say, the courage to speak up and say, oh, I do need this stuff for this pandemic, right? Because everyone does. So they are the ones going door to door, as Shahzad mentioned. And I feel like we have already given a lot away. So without further ado, let's move to
So very quickly, once again, ladies and gentlemen, I'm sorry that I still have to add a little bit to it as well, and that is that, ladies and gentlemen, unfortunately, Pakistan is not that rich of a country as well, so we have very limited resources. And not just that, ladies and gentlemen, these people, they've been doing this work for the last 14 years, not in just this pandemic as well, but may it be the earthquake in 2005 or the floods in 2010, or otherwise they're looking after girls as well, where they live in their hostel as well with the name of Bazeecha. But ladies and gentlemen, they're providing these PPEs to all the doctors, they're providing these PPEs to all of those people who are volunteering as well. How come that they're managing all of this, ladies and gentlemen? Without any further ado, we're very lucky that we've actually been joined by a social activist. She's the head Bazeecha Trust as well. She's none other than Miss Iram Mumtaz. Hello, assalamu alaikum, good morning.
Walaikum assalam, and it's always a pleasure to be in your show.
Thank you very much for being with us, and it's always wonderful to have you. And there's a reason that, for somebody who's doing such an awesome job at public service, I think that the smile actually tells me that you're very happy and you're confident within your own self as well, and you're loving what you're doing, and it's a great job which you're doing as well.
Alhamdulillah.
May Allah give you all the sawab which you really need for this one as well. But alongside Miss Iram, ladies and gentlemen, we've actually been joined by somebody who's the head of volunteers group as well at Bazeecha. She's none other than Miss Nomeena Khan. Hello, assalamu alaikum, good morning.
It's lovely being here with you, and it's the first time. I'm very happy about that too.
Thank you very much for joining us. It's wonderful to have you, but there's one question I have, and that is from you. I'm going to start my conversation from you, and that is that in all of these days, whenever I got a call from my producer that you have to do a live show, there was this part of me which was very scared of getting or stepping outside the house because of my underlying diseases as well, so there are other problems people are coping up with. So, and then I was like, this is my job, this is what I signed up for, so I have to be there. So for somebody to be a volunteer going door to door, roaming around, and this is what the government's telling you, stay at home. Don't you think that you are at risk as well? And then you've volunteered knowing that you are at risk.
Which is great, by the way. We're just asking.
We're not at risk because we wear our gloves and we sanitize as well. But we have to work for humanity. If we won't go out, who would? So that's the thing we're following. And like Ma'am Iram also calls us like frontline soldiers. So yes, we're being frontline soldiers.
Yeah, well, that's great.
That's great. But Nomeena, now I have to come back to Miss Iram over here. And let me just mention, they have even put their cell phones in the plastic covers, which is actually a good idea. I never thought of that. So great. So Miss Iram, to start with, we were talking before the show as well, but I want you to tell to everyone, you have, mashallah, a lot of girls living inside the Bazeecha Trust as well. This is their home, right? They study there, they work, they learn everything there. But when you found out this was going to be a pandemic, or this was a pandemic now, did you manage to, social distance them from each other?
Yes, of course, because we have ample experience of these things, and we need to be prepared well in advance. The main thing which is lacking here in Pakistan is preparedness. So as soon as we started getting these news, alarming news from China, that it's become a pandemic. So we put our girls in isolation, quarantine. So mashallah, for more than a month, they are inside. Even I stopped going there. I just went twice, fully equipped with my security gear and all that. So mashallah, they are inside happy. Even inside they're wearing their mask.
Nice.
Even inside they're keeping their social distances. So we train them because of course with social media and using this technology, with Skype session with the caregivers at Bazeecha. So I told them to take precautionary measures. Mashallah, they are doing very well.
And are they realizing how grave this is, unlike a lot of people that I see on social media?
Yes, of course, they realize. Only then they will be applying all the security measures.
Exactly.
And I keep talking to them. I keep calling them, taking them live on social media, Skype session and all that, so that to keep their morale high. It's not easy staying indoors.
And for such,
Okay, but I think that this one's going to be a little tricky. I'm sorry that I'm going to put you under the spot as well, but since you have been an avid supporter of PTI as well, and you've been very directly involved with all the MNAs, MPs, and everybody else, because you've been doing this work for a greater period of time now, even before you were affiliated with the PTI. So what I want to ask you, do you think that the kind of preparedness we have on national level is something to be satisfied about, or do you think that we really need to work a little more harder? Because World Health Organization, all of those organizations are saying that Pakistan has done a wonderful job. Since you're on the ground, let me ask you.
Yes, Alhamdulillah, we are really fortunate to have Imran Khan as our PM. Mashallah, he is so, like forthright and, accommodating to the sense that he's okay with it. He doesn't know much about this thing. And this thing has struck the world for the first time.
Exactly.
Which has taken all of us by, even the great superpowers have, they're helpless.
Although they are in denial,
yes,
but they're
but comparing Pakistan with them, mashallah, mashallah, we have done wonders. Alhamdulillah. But of course, there are gaps which are there. And of course, we need to educate the masses. And of course, our parliamentarians, they need to educate themselves more. Like people who are reaching out to them, because I always propagate about public-private partnership. I always say that how much can Imran Khan do? He doesn't have a magic wand with him.
Exactly.
Like the opposition, everybody starts criticizing in a short span of 2 years, they're expecting miracles from him. So I tell everybody, give him due credit. Mashallah, he is such a brave, soldier, I would say. He's the main frontline soldier, our PM. For God's sake, give him, some time.
Yes, that's what it is.
Yes, so you need to, give him due credit that he is taking all the correct measures, but his team has to be more proactive.
Exactly.
They have to be proactive. They have to be as, compassionate and hardworking as their leader is. That is what I feel is, slightly the weak areas. And the private sector who are willing to help you out, like I keep posting in all the PTI, women group and all these, even the MNAs, I keep posting them. I'm sure they must be really irritated. What's wrong with this, lady? Why is she sending? My purpose is just to educate them. Even this much difference if I can make, to help them. My experience is, I think I'm 53 years old, mashallah, mashallah. I think their even ages are younger than my experience. So try to take the help of, people who are there to help you out, who are there to strengthen your institutions, who have ample experience, who have got resources, and who can guide you. Because I am doing the training myself physically. I'm in Rawal Hospital out there. And when you ask Numina that, aren't you scared? This is literally a suicide mission.
It is, to
Let
be
me tell you
honest.
that. But then our faith in Allah, whoever comes to this world has to go. So I keep praying, Ya Allah, give me the, death of a shaheed. I really want to die serving people,
Right.
And
that's a good notion. But ladies, one thing, since we already spoke about this, you guys are not all about publicity, so I'm going to do it for you. And for that, I will have to ask you a lot of questions. So the Rashion drive. A lot of people on my Facebook, a lot of people on my Instagram, everywhere, Shahzad, you might have noticed as well, a lot of celebrities, everyone, have been, sort of carrying out these Rashion drives as well, collecting donations from a lot of people and then making packages and delivering to the people that they identified as needy. So my first question is, did you identify people who were needy, or did you just like literally randomly went to every doorstep and knocked and you were like, here's your ration?
You know what, when this thing started, first of all, we, put our girls in isolation. And the team of Bazeecha, we formed a volunteer group. And Alhamdulillah, we got such an amazing response. In mere, today is the 13th day. And mashallah, our volunteers have crossed 600 plus.
776.
Yeah,
776. Yes, she's the, yes, ask her.
We have 776 volunteers, and we have 6 different groups.
776 volunteers.
Yes, in 13 days.
Amazing.
And then we have different groups. Some are working on the ground. Some are working for education. Some are working as psychologists. We give online sessions. And then that's it. That's what we're doing. And some of the distributors who go door to door giving ration to other people.
Well, that's great. Now I need to speak about Rashion as well, because this is something which I was thinking about and I couldn't tell anybody, and there was a reason why I couldn't share it with anybody. But since you are here, so I think that you will understand it as well. See, it's not just Rashion what people need. They do need a little bit amount of money, may it be there for home rents, may it be any bills or other than that, or maybe any other thing which they cannot speak about, or there might be a little bit of stigma attached in our part of the world and they cannot purchase it. So are we looking into that as well, or are
we give them medicine, because a lot of people tell us we need medicines and we can't purchase them. So yes, we go to their doorsteps, we give them medicines, and we do give money to people as well. What somebody doesn't say, you can just see it out of their eyes. So yes, we do give them money.
And I would like to add
try
to
our
this
best.
that, there are 2-3 categories. The daily wages were badly hit, And then the daily wages, yes. So we have got two sitting here with us. And you know, the people with small businesses, they are then another group, people who have been laid off by big companies, right? And then people from humble background, they just cannot, you know, publicize it. So we ensure that, you know, no one's self-esteem is hurt. So we have got these helplines, alhamdulillah. Now the word has gotten around, people are approaching us, alhamdulillah. Out of 24 hours, I think Imran Khan and I'm the only one, we were working the most. 17 to 18 hours, I'm either, 4 hours, that's it. You know, I take a power nap wherever I am, any time of the day, you know, half an hour, and I'm fresh, you know, like a bird. And you know, like people are reaching us, and we make sure that, you know, we cater to all. And then Easy Paisa scheme is there, so many ways to send cash. And then I take a round because I think I'm ADHD, you know. I have to. I go out because where I live near Khanna Bridge, and that's a thickly populated area. And I know that, like I told you, that we had started this drive much before anybody else had started. So I knew that how bad the situation is, and we're not realizing. And the worst was that, you know, like educated people were saying, no, it is just, you know, totally hype created by blah blah blah, and so many you know, theories came up, it's this and that. I said, this is no time. Look at China, the most advanced country of the world. If they are unable to handle it, where do you stand? You stand no chance. So we started preparing. So I would go out with my Bazeecha team, you know, not together, like with my son, and I would see these, you know, Tramadi Chowk, thickly populated, daily wages sitting there. And then, you know, like typical that that military exercise we would conduct, I would just go take a survey, then park my car far away from the mob or the crowd, and then my son would get down, Hassan, he goes down, and he would just, you know, very discreetly would go near one of the, you know, the smaller group and tell them, do not get up, do not say anything, and you know, with proper security kit, and hand them cash. And this is what another video, we've got loads of videos, you know, to educate masses.
You know, the good thing is that Hassan didn't even post anything about it. Like, I love the fact that this is so sort of low-key, because that is how you're making a difference as well. But I have to add one thing over here before you do continue, Ms. Iram. You know, I do know designers, you know as well, some who have been making, you know, survival kits, or let's say these PPEs as well.
Jofa for that case.
Yeah, okay. And then there was other brands jumping on it as well, which is great, because the medical staff, first of all, they need to be appreciated well so much, probably we can't even do that in words. But a lot of people have to provide for these kits, right? Now, you guys have this as well, and you're providing this free of cost, which is amazing. Do let me know about all the things present over here and who gets to get these.
Okay, now, first let me correct you, Shiza. We do publicize. The only thing which we don't do is that show the faces of the people. You see, when we are giving ration, we don't, you know, like, this was really, you know, like, I was really, you know, put off when I saw a picture of somebody giving a soap and then a big smile, and, you know, that showing the picture of that person who's taking. That is humiliating. So that is what we don't do. We follow proper protocol, right? That's what we do. Let me correct you, because people watching there might be saying, oh my God.
Okay, thank you.
Otherwise, what Shehzad said, how are the masses going to know what we are doing?
Exactly.
And what is the proper way to do it, right?
Yes,
so for that we are doing that. Now, what you see here on the table is known as PPE kit. And which has really become, you know, commodity, essential for, need of the hour. PPE stands for personal protective equipment, and it's a jumpsuit, okay, from head to toe. It's all covered. You can see that even the shoes are covered.
I can fit in it.
Yes. So first of all, you know, like you wear that scrub, that green gown which is there, which you wear, the doctors wear for operation. Then on top of it, you wear this jumpsuit. Yes. Then you wear your mask, that N95. That has also become a VIP thing. The status symbol, anybody wearing N95.
Or N99 for that matter, I can still get my hands onto it,
Yes. So this, you know, we are, you know, government has been kind enough that they gave these kits to Rawal Hospital. By the way, Rawal Hospital is our collaborating partner in this.
Perfect.
And hats off to them, the chairperson, Khakan, and Salia, Amra Hayat, Dr. Javed, Azar Mumtaz, all these people are so supportive, alhamdulillah. Like, we just walk in and do whatever we have to do, and they've already set up, you know, mashallah, the first, you know, the filter clinic. whoever enters the hospital is the filter clinic.
Oh,
okay. And they've put a, the glass window so that the doctors are safe. We have to save these frontline soldiers, right?
Exactly, agreed.
And then the proper protocol, that there's an intercom, when the patient comes in, he's given a sanitizer, and then his temperature is checked. Then from this pinky finger, he's asked to, press the intercom.
Okay.
And then, talk to the doctor and symptom and all that. From the filter clinic, that person, if he's just, seasonal flu or things like that, is given advice that you rest at home and all that.
Okay.
If they suspect that, yes, there is something, he needs to be checked, from there, the patient is sent to suspected ward.
Okay.
And the patient stays there till the reports are out.
Oh,
and only 2 patients in 1 room. Okay, that you have to be very careful.
I think that's great as well. And ladies and gentlemen, there's one more thing which I think is very important to mention, and that is that other than, coronavirus, there are a lot of other diseases people are going through. So there's a number of hospitals who are making sure that they're not actually going to entertain the people who are affected with the coronavirus, so that their hospital premises is safe for anybody else to go in. So all you need to do is you need to do your own research, which hospitals are actually not treating the coronavirus patients, so that in case, if you have this thing in your head, whether we'll be safe over there or not. So please make sure that you put this SOP in place as well.
Right. Also, I actually thought of a small piece of information that I wanted to give out. I feel like you might have said this on the show. So we received a list of hand sanitizers, right, which were actually effective, which had the certain amount of 60 to 90% alcohol, and which were actually, sort of really making a difference in terms of killing the germs as well. So I really hope you guys get your hands on it as well. You can probably Google it, because if you are buying hand sanitizers and using it and sharing it with your family as well, buy the right ones. Now, I want to ask Nomena over here, because this was you were trained by Ms. Iram, first of all, and then, you will launch right on ground for your first mission as well. I want to ask you how that went, and did your family sort of tell you, if you're working on ground, you have to be away from us because, of course, security. Hold on to that thought, because we will get your answer right after this very short break. Stay tuned to find out. Good morning.
Good morning. All right, ladies and gentlemen, welcome back for everybody who just got tuned into PTV World. You're watching World this morning alongside Shiza Hashmi and Shahzad Khan. Today, ladies and gentlemen, we're very lucky that we've actually been joined by the team of Bazeecha Trust, who are making sure that they're going to people's places and giving them whatever is required in these times of distress as well. May it be the PPEs, may it be the ration, may it be the money, may it be the mask, may it be anything else as well. They have a lot of partners on ground. But before going towards the break, Shiza actually had a question for the volunteers' head as well over here. And yeah, Shiza, please go ahead.
All right, so Namina, we know that you were, a few months ago, probably just a little while ago, you were trained by Ms. Siram over here to be a volunteer for Bazeecha as well. You received a diploma, to be very clear. And then you have to first of all let us know what that was. And then when you, sort of decided that you're going to work on ground, how did your immediate family receive it? Were they like sort of scared for you? Were they scared for themselves as well? Or were they equally participating?
Okay, so it was when the first day was, but my brother wouldn't let me go. He was like, no, he started screaming, he was like, you can't go, something would happen. Yeah. But then Aram auntie was like, no, it's fine, there's nothing, we work and this and that, he was fine with that. But yes, it is hard when I come home from something like that. My family doesn't come near, and my mom's like, go to your room, change your clothes, and just don't come near anybody, because obviously I'm coming from the hospital or anywhere outside distributing ration and stuff and meeting different people. And when it comes to like the diploma, I have become a remedial therapist.
Oh, amazing.
In which like we are treating children which are dyslexic, ADHD, and which have like learning difficulties.
Yeah.
That's amazing.
So that's basically what the diploma is about.
And that's great, and you really need to, so you have our support, you have all the people's support who are out there and they're watching you, you're definitely our frontline warrior as well.
Yeah.
But there's one more thing which I need to ask, and that is that since you guys are a larger team, 776 volunteers in total to be more precise, but not just that, what I want to know is, so we know how you guys feel while you're helping everybody else. Now I want to know, how do they feel when they are being helped? And we have a few pictures, ladies and gentlemen, where these amazing ladies have been out there making sure that everybody's having food in these times as well. So please let us know, how do people feel when you give them what they need?
When you go out giving food and stuff to the people, they really like it, you see the smile on the face.
Yeah, I even see the lines in between for social distancing. I think that's a great initiative.
We did it ourselves.
Yeah.
We put the lines ourselves, and like people should stay away from each other. But they have a really good, they have a smile on their face, and they're very happy about it.
Wow.
Some people are not really like sort of expressive about their needs as well.
Yeah.
And when you go up to them, of course they're happy to receive it, right? Have there been some sort of, instances, maybe no, maybe yes, where people were not sort of as responsive as you thought they should be?
Yes.
And how did you deal with it?
There were like sometimes, you have to face this. One thing like, we didn't like it wasn't about liking, it's because, people are facing stuff. When I went to somebody and that lady was like, don't take my picture. Okay. I was like, no, I'm not going to take a picture. I want your CNIC. What we basically do, we take their CNIC for record and, checking up. So we take a picture of that. And when I just gave her the ration, and she was like, don't take my picture. I don't want to come into the camera, people knowing me and stuff like this. So that was the thing that hurt me. Just feeling that she was
genuine concern, right?
Because not that way, but she was scared of just me taking a picture.
And people do not want to be in that position as well.
That's the thing. They don't want to come onto screen being like they're taking the faith pose and stuff like that.
Yeah, but very quickly, what is inside your ration bag? Let's talk about that a little as well, if you guys don't mind. Yeah.
Okay, so we have flour, we have rice, we have lentils, we have oil, we have milk, we have tea, we have tomatoes, potatoes, onions.
So it's like a complete package.
Yeah, it's a complete pack. We hope a person can use it there for 15 days at least, and there's a big one for a month.
Wow, so that's great. So how much does one single ration bag cost? I mean, for all of those people who might want to help the Bazeecha Trust, let's just ask that as well.
Okay, yeah, I would answer because the one like the small one for like 4 to 5 people, it costs like about 3,000, and the larger one for like more people is 5,000.
All right.
Okay, the small one is for around 45 people, you said.
No, 4 to 5.
4 to 5.
4 to 5 people is,
no, 45, 45.
Got it. Yeah.
People in like one house.
So which is why I'm going to ask you, how can people donate if they want to donate for your cause as well? And then not just that, who are the other partners who are working with you? I think that it will be beautiful to mention their names as well.
Absolutely.
Please go ahead.
First of all, Rawal Institute of Medical Sciences, like I told you, it's a hospital near Khanna Bridge.
Yes.
So over there, we are working on ground with the medical professionals. you know, big salute to the whole team of Rawal. Then we've got in our volunteer group, we have got a lot of organizations, you know, youth organization. So youth organization, and Numaina would be, you know, in a better picture to let you know about the youth partners. But otherwise, generally, the big partners I'm telling you about is Rawal Hospital.
All right, that's amazing.
They're really supporting us. And you can tell about the youth.
Yeah, we have like some different, you know, not NGOs, but they're helping hands. They're working with us like youth education and Jazba, Josh Jazba, and Josh Janoon. Yeah, I don't remember their names well.
Okay.
But yeah, they're working with us and they're helping us around, you know, giving away ration and stuff. What we're doing, they're doing the same. But yes, they're not our donors, but they're doing it on their own ends. So they're not our donors.
And that's great too as well. But now very quickly, it's great that you're providing them with ration, you're providing them with money. But not everybody is providing them with PPEs and these surgical covers and hats and, you know, soaps and sanitizers. But in this time, and whatever is going on, ladies and gentlemen, because I went to a chemist myself, asked for gloves and, you know, the mask, and they weren't available. How are you getting your hands onto PPEs where, you know, they are not even available for the doctors? How are you getting them?
You know, like, I think if your intentions are good, you know, Allah helps you.
Alhamdulillah.
That's true though.
Where do you think my intention was wrong? I was looking for a mask for myself and a glove, you know, I couldn't get it.
When we formed this group, you know, like you would be amazed, Shahzad, like the response which we got. These gloves which I brought as a gift for all of you, you know, like this young fellow came up to, you know, like he contacted me and he said that, you know, we are dealing in this. I said, okay, now what's the rate? Much cheaper than what they're selling in the market.
Okay.
And this one area which I need to, you know, discuss, inform the public as well, that for how long can we give them ration? Because this is an indefinite, nobody knows how long it's going to last.
Absolutely.
So we have devised a plan for that as well, because we've got a vocational center at Bazeecha full-fledged. So now in a second phase, for 1 month we have given them the ration. Second month what we are going to do is, whatever your skill is, approach us. And Bazeecha girls are already making scrub. Scrub is that, you know, that short shirt and a pajama which the doctors wear.
Right.
So under this PPE kit, you are supposed to wear that. And they're not available in the market, right? So I have already, you know, given the cloth to my girls. And of course, we have spread the word. Whoever wants to, you know, earn a living, a decent living. Now, enough of freeloaders. Yes, you are skilled, sitting at home in your, you know, like privacy of your own place. Plus, but when you will work, you have to wear the scrub, the gloves, and everything.
I think I like this idea, and there's this famous proverb as well, ladies and gentlemen, where they say, "Do not give needy a fish." Teach them how to actually fish. I think that's great.
Yeah, you know, the best part about this is the sustainability of the project itself. Ladies, you're doing an amazing job, but towards the end, I want to talk a lot about awareness, because I feel like we did sort of give a lot of information about this. So Shahzad, last Friday, Sindh government sort of declared a proper, like, strict lockdown for 3 straight hours, because they sort of wanted to hold people back from gathering in mosques for the sole purpose of social distancing and isolation for their own security. But there was a very large, insensitive, sorry to use the word, stupid mob, which sort of, you know, attacked the police as well, people whoever were supposed to take care of them on the roads. Imagine they're, you know, risking their lives, Shahzad. They attacked them without the fear of them, first of all, getting infected, and then spreading the infection, or, you know, all these diseases to all the other people in the area too. Don't be those people, first of all. You are as much responsible, you are as much sort of contributing to this as any other person is. So, Ms. Hiram, any message from you in terms of awareness for all the people watching right now?
Yes, first of all, I would request everybody that now all the information about this pandemic is available on net. Just click, press, and please follow the instructions religiously. You have to follow them yourself. We can't, you know, you have to practice what you preach. So I wear, just because of this program, I'm not wearing my proper kit, right? But you can see that my hands are under this. And look at my cell phone. Now this thing which I need to tell you, that especially the medical professionals, all who are working in the hospital, irrespective of wearing your PPE kit, your mobile is the most dangerous, you know, thing which catches all the virus. You take it out, you talk, you go home, and the first thing your kid wants is your mobile to play the game. So we have devised a plan for this here. These are available. You just put your mobile in this, and this is smaller, but a bigger one. Okay, make sure that it's bigger than this, sealed. And then you use it. You can see. Okay,
but now I know that we really do not need to get a phone with a larger screen, because otherwise you cannot seal it as well. But thank you very much, ma'am, for what you're doing and what Bazeecha Trust is doing, and you really make us proud as well. With 776 volunteers to look after, and I think that you guys are doing a great job. And not just that, I think I'm just thankful from the bottom of my heart as well. They brought all of this stuff for us as well. Their masks as well, their gloves as well, and everybody needs them, ladies and gentlemen.
Yeah, true.
So kudos, thank you very much for being with us.
And I would like to add one more thing, please. Have faith in your leader, have faith in Imran Khan, and have faith in Allah.
Absolutely.
And whoever has come to this world has to go. Reach out to others, stop hoarding. Whatever is written in your faith will come to you, and rise above these petty politics. Now is not the time to,
or any conspiracy.
Score points and be in the good books. Whatever is written in your faith, you will get it.
Exactly.
So for God's sake, I'm begging you, I'm like your sister, please have faith in Allah.
Absolutely.
Yeah, that's great. And Shiza, I'm just going to come back to one of the points which you raised over here, and that was that on Friday there was a lockdown in Karachi for 3 hours as well. So ladies and gentlemen, let me be very clear on this as well. I think that people do not have an understanding of when they pray, and there's a reason, because we kind of haven't actually read all of those Arabic verses in Urdu as well, and there's a reason why we haven't done it, because there was no culture of it. But if you listen to the azan carefully, azan itself is telling you to pray at home. They're not telling you to come to the mosque as well. So please make sure that you obey what has been said on those loudspeakers as well. And eventually I think everybody needs to feel so amazing about themselves that, the azan, the prayer call itself tells you to pray at home. So that means that all that sawab which you need to earn will be earned while being at home.
Absolutely.
And that's what people need to do. Ladies and gentlemen, please make sure to take all the precaution measures. Babies are actually, or kids are actually said to be super spreaders, because they do not have any symptoms, but they can be positive with the virus, and anybody else can get them or get it from them as well. Please make sure not to kiss all those babies as well, because they can be, they have the equal chance of getting the virus too as well.
Or they can be carriers.
Yeah, or just do not touch your face if you haven't sterilized your hands. That's
absolutely.
It.
And if you
sanitize.
please avoid going outside, and if you do go outside, as soon as you come back, just immediately change your clothes, because it stays onto the fabric for more than 10 hours, and that is what you do not want for your family members to have as well, right?
And you really do not want all of those family members to come over to your place who do not live with you. All right, this is a time where nobody is welcome at anybody's place. So guests showing up at somebody's place, I'm going to tell you on your face, go away, because that's something which is putting my family, my parents at risk, and I do not want it for anybody of you.
It's justified, man. It's justified. If you've learned anything from us, write to us on our Facebook page with the name of
World This Morning.
On Twitter.
World This Morning without a G.
Daily Motion or YouTube.
On Daily Motion, ladies and gentlemen, it's World This Morning. On YouTube, it's PTV World, and you have to look for the program.
Yeah, absolutely. And the repeat you can catch at
11 p.m. tonight.
Well, till the next time, take care. Good morning.
Good morning. Thank you.